Hey there. This is a recording for anyone with chronic pain, particularly around a joint in your body, maybe your pre or post surgery joint replacement, and you're looking for something that is non invasive to help to calm and reset and soothe your nervous system. So, this is a practice for you. So, the first thing that I'll invite you to do is lie down. And if lying down isn't comfortable, go ahead and just find a comfortable position. Maybe it's reclining in some fashion and just get cozy. And if and when you feel comfortable doing so, go ahead and close your eyes and just start to center yourself, start to breathe, and start to clear your mind. Clear your mind in a way that works for you. So, this practice will help you to explore movement and this pain, this perceived pain, whether or not it's a lot of pain or just a little bit of lingering pain, with fresh eyes. So, we're going to reset the perspective here on feeling and experiencing pain. So remember that pain is protection. It's a good thing. Pain is protection, and protection is a good thing. And sometimes we get in the habit of not moving in a particular way in order to protect a part of the body. It's a good thing, right? It's an adaptation in the moment. And the important thing to remember here is this is not a mistake. This is not a mistake that your body has made. It's not something that you shouldn't have done, that shouldn't be happening. This is very normal. This is just a behavior that happens, and then sometimes what happens is this behavior gets repeated, sometimes for weeks, sometimes months, sometimes years, sometimes a lifetime. So before we dive into this, I invite you to thank your body for creating this boundary, this protective boundary of not moving toward pain. So we know that your nervous system and brain are responding to signals that the nerves are sending to your body through your nervous system. So we're just responding machines, basically. And so if it's become proficient at producing pain, your body is producing pain, it's saying, hey, no, stop that movement, it hurts. We get used to that. And so, what we're trying to do here in this meditation is to discover the line, the fence. You can think of it as like an actual fence or just like a boundary, a line. And we're trying to see if we can change or alter or rearrange the brain's perspective in terms of where is this line. And this line in this instance represents movement that we can do and movement that is off limits or movement that produces pain. So there's the line. On one side of the line, there's movement that's acceptable. On the other side of the line, there's movement that hurts, that we don't do. Okay? So what we will do in this meditation is work with that line, work on calming and soothing and deep breathing and feeling sensation as it's actually showing up in the body. And again, see if we can rearrange the perspective of your nervous system, of your brain. Okay, so that's basically what we're going to work to do here. So, the first thing that we'll practice, that I'll invite you to practice, is to come up with and then repeat an affirmation. We can call it a mantra if you'd like, but something like, I am relaxed, I am calm, I trust my body to heal. I see and envision a life where I'm strong, where I'm healthy, where I'm moving and grooving and enjoying life post surgery or post, these limitations of range of movement. And if you are about to have surgery, maybe your affirmation is something like, I trust my surgeon. I trust modern medicine. It will work out. I trust in how it will all flow. My life will be wonderful afterwards. I'll be pain free. If it's helpful here to visualize getting any aspect of your life back after you've had the surgery or after you're pain free, go ahead and try that now. Mhm. So now that you've done a little bit of visualizing, we're going to work in another area of your body, and that is working with your breath. So let's just take about 30, 45 seconds here, and we're just going to breathe together. Just take a breath in through your nose or mouth, whatever is most accessible. Let your chest and belly rise. Maybe you reach your arms out and you just take a deep breath in. Long exhale through your nose or mouth, whatever feels best for you. And do it again. If you're exhaling through your mouth, open your jaw and let your mouth and your jaw relax. And if it's helpful on your next exhale to make a sound and audibly get out any stress, any worry, any fear, and imagine that you're gathering all of that up, putting it in the form of this little box that is your voice, and you're sending it out on your exhale. Good. Try it one more time on your own. Good. Now let's breathe in for a count of 6, 5, 4, 3, 2, and 1. Hold. And exhale out any more worries that you have. You can exhale counting backward from 8 if you want. Okay, and at your own pace, breathe in for 6, 5, 4, 3, 2, and 1. Hold. Exhale. Any worries about the pain never going away, it always being like this, any of the narratives that you have in your head, let them out. Just for this moment. We'll do this one more time at your own pace. Okay, so breathe in. Hold. Exhale. Awesome. And we're about halfway through our meditation. Next thing that I'll invite you to do is to welcome these thoughts in. So I've mentioned a couple different examples of thoughts or thought patterns that you might be having. Let's invite them in for tea as a little visual here that might be helpful. Invite them in. They feel scarier when we don't open the door to them, so to speak, right? It's like they're behind this door, they're big, they're bad, it's a mystery, it's the unknown. Let's invite that in just for this moment. Any of those fears, let yourself fully feel it. And there's a purpose to this. Good. And this might be something you need to practice a few times watching this. It's hard, I know. Good. And then let those thoughts exist. And then also keep breathing. We're just going to do both at the same time. I know it sounds simple, easy, maybe silly, but try both. Hold the thoughts. Let them be here. Come on in, sit down, and breathe. Keep breathing. Breathe. You're here. Breathe. You're okay right now. And then slowly shift your focus to just breathing. The thoughts now become kind of like clouds in the sky. And so we invited them in. We got to know them a little bit. Hopefully, they're not so scary. And if they are, that's okay too. It might be part of the process of assimilating them, digesting them. It's a process. We're not going to solve everything in this one meditation. It's a process. So now just focus on your breath. If your mind wanders to the thoughts again, let them move through your mind like your mind is the sky. The thoughts are the clouds or birds. Good. And as you're letting these thoughts move through the sky of your mind, you're not analyzing them. You're practicing non attachment to them, meaning they're just there. You're not forming stories about them. You're watching, witnessing, observing the thoughts. Okay. So now we'll move to the final portion of this meditation. And it does involve either visualizing movement happening or actually slightly moving. Okay. And specifically, you'll move the part of your body that is in this pain. Okay. And so, for example, if it's your knee, the knee flexes and extends, and it can do so, to a large degree. But for this particular meditation, you won't do it to its full range of motion, at least the first time around. You might listen to it a few times and then eventually get to your full range of motion. But if this is your first time, you'll just do it maybe half or a quarter. Or if you're post surgery, for example, it might just be visualizing the movement. Okay. And if it's another part of your body, same thing. You just do half or a quarter of what's possible or visualize. Okay. All right. So feel into that part of your body. Remember, you don't have to move here. You can just visualize. And remember, what we're doing here is we're finding that line, that fence, and we want to see what's on the other side of the fence. We want to rearrange our relationship with movement that has been labeled painful by the mind, by the nervous system. Is it really still painful? Because pain is a protection, pain is a messenger, and that message might be expired. This is how the nervous system works. Our bodies, we are animals, we are biological creatures and beings. So we are here surviving. And so the body and the nervous system are built in such a way that it's protecting us. Okay. So that's why we're doing this in such a kind of seemingly simple way. Because it's not about the movement per se, it's about the intention behind the movement. All right, so go ahead, place your focus on that part of your body and say it's your knee. Go ahead and just bend your knee or visualize bending your knee 5 or 10%. Stop and breathe. Yep. And then bring it back to the resting position, whatever that is for you, whatever that resting, feel good, best position is. We're going to do this just maybe 3 or 4 more times. So go ahead when you're ready, move that part of your body again, maybe a little bit more. And as soon as you start to feel pain, if it feels okay to stay right there, stay there or back off a little bit and breathe. Notice any thoughts that come up. Keep breathing, don't hold your breath, that's huge. And then go back to rest. Let your full body rest, your full being. Deep breath in. If needed, if necessary, come back to your affirmation or your visualization, whichever one worked best for you, whichever one was the easiest to find. We'll do this a few more times, okay? So go ahead and bend or move that part again. And if you haven't felt pain so far, it might be that the meditation's working for you, or it might be that you still haven't found that fence. So you want to try to find that fence here in this meditation. And once you find it, stay there. If it hurts really badly, obviously move out of it a little bit. Don't hurt yourself again or re-injure anything. Although this whole thing is quite gentle. Good. And then come back to neutral, whatever that resting position is for you. And then one more time, final time. Maybe it's your full range of motion here, if that's even possible with what you have going on. Maybe it's finding that fence, really taking a deep breath, giving the body a chance to rearrange, reorient to this movement and hopefully new movement. Yeah, and then rest whenever you're ready. Good. So that's it for that. Just take a couple of deep breaths here. And go back and recall your visualization, your affirmation. Give yourself a chance to Just go inward for a few moments here. Finding your center. Letting your body deeply rest. You're welcome to rest here for as long as you'd like. And if you're ready to move on with the rest of your day, start to just wiggle your fingers, wiggle your toes. Take some really big inhales, audible exhales, open and close your jaw, maybe massage your jaw, and make your way up into a seat. Thank you so much for sharing some time with me. I hope that this meditation has helped you to learn a little bit about what's happening and why it has happened, to know that it's not a bad thing, it's a protection, and hopefully we did a little bit of updating to your nervous system. Thanks so much.